It's so important that autoimmune diseases like rheumatoid arthritis get highlighted as the women's health issues that they are, but y'all, we can't forget about the men. Up to 1/3 of those with rheumatoid arthritis will be men, which translates to a lot of people. Although rheumatoid arthritis affects the same joints, causes the same inflammation, and can lead to the same joint damage in men and women, there are some differences that are important to understand if you are a man with RA, or if you love one. So today, I'm going to be answering questions about differences between men and women when it comes to rheumatoid arthritis, what we know about how hormones play a role, and how men with RA can get the support they need. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. The first question is rheumatoid arthritis different in men versus women, and if so, how? So the answer to this is yes and no. Rheumatoid arthritis is a systemic autoimmune inflammatory condition that primarily affects the joints, causing joint pain, swelling, and stiffness. This is true in both men and women. The symptoms of joint pain and swelling in the hands and feet are the same, and the risk for joint damage from uncontrolled inflammation is the same. I say to our current knowledge because we are learning more about the role hormones play, which I'll get into later. So no, fundamentally there is no difference between RA and men and women. However, studies show the experience of rheumatoid arthritis in men versus women is different. Generally speaking, it is seen that men with RA tend to have less severe flavor of arthritis. But this is actually a bit controversial. You see, when studies look at these types of things, they attempt to take the individual's experience of pain, fatigue, and all the other symptoms and whittle it down to a score. It's only with numbers that researchers are able to run statistics to then draw conclusions regarding how a large number of people are doing. Well, whittling down any person's individual experience of joint stiffness or fatigue into a number isn't a clear science, as you can imagine. What I might call 9 out of 10 pain, you might call 5 out of 10. So that statement that men tend to have less severe flavor of RA is based on these imperfect calculations. So it is actually less severe, or is it just described as less severe? And why would there be a difference? Well, one theory is related to the fact that generally men have more muscle mass and strength compared to women, and this can help compensate for limitations brought on by joint inflammation. Or is it related to a difference in response to treatment? Or is it related to different treatment options offered to men versus women? We still have a lot to work out. What isn't as controversial is the fact that men with RA tend to have a higher risk of cardiovascular disease compared to women. I am harping all the time that rheumatoid arthritis carries with it an increased risk of heart disease to the same level of diabetes in both sexes. This is why controlling inflammation is so important. And yes, we want to control pain and stiffness today, but we also want to prevent health problems in the future. Well, men's risk seems to be even higher. What's more, they tend to have higher rates of the more traditional risk factors for heart disease, like high blood pressure, high cholesterol, diabetes, and are more likely to be smokers. So control of inflammation and all of these risk factors is important for everyone, but needs even more special attention in men with RA. And then finally, men with rheumatoid arthritis tend to have a higher risk of developing lung disease related to the RA. This is called interstitial lung disease, and I have a whole video on how RA can affect the lung, so check that out after this one if you're interested. And by the way, if you've been having difficulty getting a diagnosis or an explanation for your joint pain or any other symptoms that may be autoimmune, I recommend downloading my free appointment home run handbook. This will help you think through all the important information your doctor will need to know in order to get you answers faster. It can be tough to remember everything we've been feeling, especially when we are trying to push through. So this guide will walk you through your symptoms, your history, and your family history, and have it all laid out for you and your doctor to discuss. It's absolutely free, and you can download it via the link in the description box. Because autoimmune diseases like rheumatoid arthritis are predominantly seen in women, it can be easily assumed that hormones play a role in developing these conditions. So how does that work if you're a man? What role, if any, do hormones play in men who get rheumatoid arthritis? Well, as you can probably guess, we don't know for sure, but there is interesting science looking into the role of testosterone in men who develop RA. Testosterone is a sex hormone that is found in both men and women, but in higher amounts in men. Like every other hormone, testosterone has many different functions, and one of them is to help regulate and balance the immune system. Early studies have found an association between low testosterone and rheumatoid arthritis. Notice I said an association, meaning it's not proven to cause it, but is an interesting thread that researchers are pulling. Sex hormone binding globulin, or SHBG, is a protein that binds to testosterone, taking it out of play per se, and limiting its ability to have its regulating effect on the immune system. When the SHBG is high, free testosterone tends to be low, and thus we see another association with RA. Now, testing for testosterone or sex hormone binding globulin to make an RA diagnosis to monitor how your RA is doing is not something that's ready for prime time yet. There's still a lot of research that's needed. But this research highlights the continued work on hormones and rheumatoid arthritis. The hope is that these insights will lead to not only better understanding of why RA develops, but then show us ways we can prevent it altogether. So are there special considerations for men with rheumatoid arthritis? And actually there are. Rheumatoid arthritis, like every other autoimmune disease, is life-changing and impacts every aspect of someone's life. It also can have an effect on how someone sees themselves and thus how they move through the world. Men with RA can face unique challenges, particularly due to societal perceptions of masculinity and physical strength. The impact of RA on physical abilities can affect anyone, but for many men, acknowledging the loss of physical strength and how that may impact their view of themselves is an important part of incorporating RA in their lives and learning how to thrive despite it. This can be further compounded if joint pain and its associated physical limitations impact their ability to work. This can then bring up issues related to perceived inability to financially support their family, which can, again, cut to the heart of what many feel it is to be a man. These are often not easy topics to bring up or discuss with our loved ones or our doctors, but they are important. Everyone may deal with these issues in a different way, from not being bothered at all to avoiding the topic altogether and then maybe avoiding rheumatoid arthritis treatment to allowing it to drag you into a depression. We all know that our mental and physical health are intimately connected. So if you're finding yourself struggling with these issues or even the fear of what may happen in the future, I recommend bringing it up with your doctor sooner rather than later. When you first get a diagnosis of rheumatoid arthritis, there is so much to discuss, but add managing your work to the list. You can simply start by saying, can we talk about my job and how RA may affect it? What can I do to make sure that I can keep working? This will open up the conversation and let your doctor know that this is on the top of your mind. I am always careful when discussing gender differences in autoimmune conditions, especially when we get to the touchy-feely stuff. We have to acknowledge that these are broad generalizations, and I don't want it to seem very kind of men are from Mars, women are from Venus, as this tends to reinforce stereotypes. But we also can't ignore how many feel, and this is supported by the literature on the subject as well. If you are or know a man with RA, I hope you found this helpful, got you thinking, and took some notes to take back to your doctor. If you want to learn more about how we think about RA treatment, I recommend watching this video next. Thanks, and we'll see you next time.